Support for the podcast comes from Philadelphia Integrative Psychiatry, a practice in Devon, Pennsylvania that combines multiple psychological and medical disciplines to build a truly holistic, individualized model of comprehensive integrative care. By providing all of their services under one roof, they aim to bridge a gap in mental health treatment. Their marriage between mental health and physical health helps to identify core sources of distress for their patients, be it psychological, medical, or a combination of both. Their team of mental health professionals and nutritionists have varying backgrounds, education, and emphases. They truly have someone for everyone. Learn more at phillyintegrative.com. Hello, everyone, and welcome back to Parenting Stuff I Wish I Knew Sooner and Want You to Know Now. I'm your host, Erica Desper, founder of the Center for Confident Parenting, and a mom who seemed to learn everything I needed to know the hard way. My guest today is Dr. Reza Madani, a dad of two kids, ages 7 and 9, and a board-certified pediatrician at Center City Pediatrics in South Philadelphia. Dr. Madani has traveled the world, over 20 countries. I'm super jealous. Been on medical brigades and worked extensively with children with special needs. And in this past year, 2023, was named Best Pediatrician in Philadelphia in the Metro Phillies Best Awards. Congratulations on that, and welcome, Dr. Madani.
Thanks for having me.
Yeah, thanks for joining me. So I know you, but not everyone does. So first, tell us a little bit about yourself, your family, maybe how you came to do the work that you do.
Yeah, I feel like, so I've been a practicing pediatrician in Philadelphia for 13 years at Center City Pediatrics. I was a camp counselor way before that for many years, and I think I just love playing with kids and being with kids. One of my travels was in Italy, working at a school in Italy with like kids with some disabilities. Mm-hmm. And that was just, I loved kids my whole life. And I loved my pediatrician when I was growing up. And I think that was a big role model for me. So yeah.
That's really cool.
Yeah. So I've been practicing in Philadelphia. And it's been 13 years. Like you said, I have a 9-year-old son and a 7-year-old daughter. And, I have a wife who is an MD PhD, works full time in neurology, and also does research on ALS.
Oh, wow.
Yeah.
See, even I'm learning something today.
Yeah, exactly.
Awesome. Did your pediatrician get to know that that's what you went into?
No, my pediatrician retired. I was going to my pediatrician well after college, I think. I was like 24 years old, and then I can't go to a pediatrician anymore. I'm going to med school.
Like, you're kicked out. Well, they must have really had a nice bedside manner.
Definitely.
Awesome. So, of course, I have some dad questions for you. We love to get the dad perspective on this show. But first, let's do some burning pediatrician questions. Are there things, as a pediatrician, that we as parents are doing, particularly when we come to you, that you wish we didn't do? For example, bring you a picture of poop or something like that. What are things we should not be doing and bringing?
Oh my gosh. I mean, we definitely would prefer pictures of poop than the actual poop itself, I think.
Good point.
Yeah.
Noted.
But yes, we don't want to really see the poop or smell the poop. I mean, there are situations where we do need to see the poop, but we'll let you know if we need to. We'll maybe start with the picture first. Mm-hmm. I think for pediatricians, it's kind of like if you show us a picture of poop and we say that looks totally normal and that is able to decrease your stress and, make you a much happier parent, I think that's a win for us, right? So
absolutely,
that's a totally easy thing for us to do. But poop aside, I think, one of the pet peeves for pediatricians is, when parents will call us about the fever of 99 or 99.5. I don't know if you've done this in the past. But, it's like lots of parents will call us. You haven't. Okay. So it's like lots of parents will call us and it's like fever is defined as 100.4 or higher. I feel like we get so many calls about fevers of 99, like maybe like the child was crying or the child felt hot in the head and the parents take the temperature, and I feel like that just takes up a lot of time, and it's a lot of just teaching and a lot of time that we don't have to like get back to parents. And usually it's like 2:00 in the morning or 3:00 in the morning.
Yeah, for sure. Okay. So that's good to know. And the second question I was going to ask you is, what are things that parents tend to worry about that maybe they don't need to worry about. So a very low grade fever, we could just chill. And then if it goes above
100, yeah,
100.4 or
100.4.
less, is there like, does it need to
Yeah, and
last a
also
certain number of
it's not just
days?
about the number. Honestly, like fever is your friend. I mean, if a baby, if it's a newborn under 2 months old, a fever of 100.4 or higher is an emergency. So under 2 months, like yes, you want to call us if the fever is over 100.4 for sure. We would probably send you to the ER.
Right.
But if a child has a fever of 101 and is playing and stuff like that and running around, it's probably okay. Like their body is just probably fighting something. If it's lasting for more than 3 days, we usually like to see you guys
Yeah.
just to make sure there's nothing, no other kinds of infection. And I mean, if you're really worried, if a child is like very sick looking, and I mean, if you're just really worried about a fever, you just call us. But some people also will email us if the child is sick. We don't. That's not good because our emails like you need to like call us because we don't get back to the emails in
So
time if
definitely
your
a phone
child.
call. Okay.
Yeah. Um,
Another
but
annoying thing that we do.
yeah.
And I'm sure every office is
So,
different, but definitely for
yeah.
yours, phone call.
And I feel like also I feel like for us, for pediatrics, a lot of our parents trust us. I mean, we trust our pediatrician. They trust us and they use us for a lot of information. I mean, some of these questions they ask us are stuff you could probably access through like the village around you, right? So like,
Yeah.
if you have family, if you have other support, friends, teachers, I feel like sometimes the first pass question comes to us, but maybe if it's not like a exactly medical or like a emergency health question, you could maybe ask a friend or a family member or a teacher or a parent coach or a sleep specialist or a lactation consultant. Or honestly, there's a great resource, which I have to like get on the soapbox and talk about. It's healthychildren.org. I don't know
Yes.
if you use that. It's amazing.
It
And it
is a
really
good
like
resource.
any question a parent has, it's backed by the American Academy of Pediatrics, which is what backs us, and it's like science based. And if there's a question about teething or a question that's pretty simple to be
Yeah.
asked, you can look there first before you go through us because we're sitting there, with a full schedule all day, and it's hard to like get back to all these questions. We have amazing
Right.
nurses, but I just feel like that's an important thing. I think that use the resources you have around you before you just
For
use the
sure.
pediatrician.
Yeah, I like Healthy Children for sort of when to worry about milestones. Like,
Yes,
is there
yeah,
such a big range of normal, is what I always tell parents, and your child could be on the just the slower side
yeah,
of normal.
right,
So that is a really great
right.
resource. Okay, what other things are we worrying about, maybe too quickly or too much, that are like we could chill?
I mean, we could do a whole podcast about this probably, but I guess it's really tough because I mean, if a parent is worried, I mean, we want to know about that. It's like
Yes,
you have to trust your
even if
gut.
it's just to get peace of mind.
Yeah, exactly. And I don't want to just kind of I feel like most of my job, I'm reassuring parents about things that I do think that sometimes parents will wait for their well visit. If as the kid's older, they have a well visit every year, right? And they come in with like 20 questions. It's like the trumpet playing, like dun dun dun, dun and they come out with a big list of a
A
scroll of questions.
scroll.
I'm like, well, what is that? Where the visit was done, and then it's like, well, I had before you leave, I have questions. So I'm
Right
like, oh,
before you
but
go.
like and it's sure we love like answer those questions, but I feel like first of all, like we talked about, like first pass, maybe ask a friend, ask a family member, look up healthychildren.org because one, you'll get the answer sooner. You don't have to wait till the well visit, if you're
Right.
worried about it for months, like, and two, it saves us time when we have 20 minutes for like a well visit. So it's like the visit was
Yeah,
already over.
that's the hard thing. There's so much that
Yeah,
has to happen in
I
that
know.
time. And I'm sure it's even hard to be reassuring and then also do all that you need to do.
Yeah.
Now, there's a flip side to this that you and I were
Yeah.
talking about before I hit record.
Yeah.
So I was trying to be the not worried mom of my one kid, and he was all I had for comparison. I was like, I'm so experienced. I'm going to be super chill. And, he just has a run of the mill cold. And then it kind of got worse and lingered, and I, I did finally take him in, and it turned out he had like four respiratory things all at once, and they were like, why did you wait so long? um, so I guess it can go that way too.
Yeah. I
Right,
mean,
are there things that you definitely want to see?
yeah,
Like,
it's
what
really
could we
tough.
be chill about that you really want to see? Obviously the fever you talked about.
We find it's just like they're vomiting. It's probably just a little GI bug. And meanwhile, they have like to do surgery on their belly, right? So it's like,
Right.
oh, like that they should have come in 2 days ago. But it's like so often.
Right.
Sometimes with the rashes, a parent like sometimes they're like, oh, it's just a little rash on the arm, and I'm like, well, okay, you can wait for 2 days, and then like I'm like, well, this is actually so bad. Like we, so some parents like their degree of like worry is a lot different. Everyone's different, right? So it's like,
Yeah. There's a
so sometimes
spectrum.
it's better for you guys to just call us and walk us through it.
Yeah.
I mean, rashes are really tough to diagnose like over the phone. So oftentimes parents will
Absolutely.
call us and want an antibiotic or want a medicine for a rash, and we just don't know if it's fungal, if it's bacterial, like if it's even important.
You have to see it. Yeah.
Yeah, sometimes we have to see it, I guess. And parents will often call us and be like, they have a fever, can we get an antibiotic? But no, like we, you need to
You
be
got to kind of
seen. And it's like,
get
yeah,
curious and get to the root of
yeah,
it, right?
yeah,
Yeah. So that's something that maybe parents find annoying that doctors do.
yeah.
Like, well, I should bring you in. But you're not doing it to make us crazy or to bill the
Oh,
insurance. It's
yeah,
like we really need to see some things need to be seen to be
right. And
diagnosed
I
and
mean,
treated.
I've seen kids that, were complaining about ear infection, like ear pain, and then their ears look totally fine. And if I had called an antibiotic in, I'd just save like 10 days of doing an antibiotic for no reason. But like maybe they complain of ear pain because their teeth are hurting, or maybe they complain of ear pain because
Right.
they're having like a headache or something like that. Like I had one
Right.
kid with an ear complaining of ear pain, pulling his ears, and had a huge tick in the back of the ear. That I was like, oh
Oh
my
my
gosh! I
goodness.
was like, the ears look
Right.
totally fine, but so then at the end, I just looked at the back of the ear. I'm like, wow, that was a humongous tick. And the mom like, almost
Wow.
fainted in the room. She was like, what? I did not see
Oh
that
my
at all.
goodness. Right. She
But
must
like,
have felt terrible. That
yeah,
was like when they
exactly.
said to me, didn't
Right,
you see his chest sucking in when he
right.
breathes? And I'm like, I
Yeah,
didn't take off his shirt and stare at his chest.
yeah,
His breathing
oh, yeah,
sounded normal to me.
exactly.
Yeah, you can definitely beat yourself up about that.
Yeah,
So it sounds like we can, check around, see what friends and family say, maybe healthy children, but when in doubt, call. The worst that happens is we say like, wait 2 days or, watch for this
yeah.
or that. Okay. What would you say to a parent? We talk a lot on this show about being told like wait and see or kind of being having your concern, dismissed.
Mhm.
What would you say if a parent brings a concern to the pediatrician and the pediatrician doesn't share their concern, but that
Yeah,
parent's gut is really still saying like something's up? How would you want someone to come back to you and sort of gently push and say like, no, I really, really want to explore
yeah.
this?
I mean, I feel that, that happens a lot. We try to reassure parents and we look at, like you said earlier, there's a spectrum of development. Like, there are certain dates where you're supposed to get certain things. You're supposed to walk by 15 months and talk by 15 months, have your first words, have your first steps. And if you're not, then maybe you go see early intervention and get physical therapy or speech therapy. But some kids, it takes a little longer. And sometimes it's like, there's little nuances like, oh, the parent didn't talk till 2 or,
Yeah.
and that's like, that could be reassuring for us. And sometimes we'll say like, okay, sometimes like waiting a little bit in that sense, like as far as development is okay, kind of waiting and seeing, or getting services and getting a little help, or, I mean, there's a great resources. I mean, we pay tax. I mean, in theory, we all pay taxes. So there's like early intervention,
Yeah.
is run by this, state, and basically you can request early intervention to come to the house and evaluate your child if you're really concerned. Let's say the pediatrician wasn't really concerned, but you're still a
Right.
little concerned about child's development. I mean, I will always just defer to like have them get the therapies if a parent's
Yeah.
super
Just
worried.
check it
But I
out.
mean, if some people, sometimes it's also, you don't want to stress patients out too much, so you don't want to say, oh, you definitely need to get all the therapies right now. So sometimes you say
Right.
watchful waiting. But you can get early intervention to come out to the house and evaluate the child and see if they meet the criteria for getting speech therapy or physical therapy or occupational therapy.
Yeah.
But I mean, if it's something like there's a lot of I've had kids recently where even I was really really worried about the child. I sent the child to the ER, and the ER was not very worried, and then that made me like kind of be like, okay, I guess like they saw them in the ER, and then but then like they were worse, and I sent them back, and they had something serious,
Right.
and it's like
Oh man.
kind of like
Yeah.
sometimes and it is very strange in pediatrics and in medicine in general. Like, your kids, like sometimes you bring them to the office and they were like really sick like 20 minutes ago, and then they are, not sick anymore. And they look
It's like
great,
when
and
you
they're
take your car to the
yeah,
mechanic and you're like, it
exactly,
was just
exactly.
making a noise.
Yeah, exactly. It's And like, sometimes for us, it's really great if like you're taking a video or a picture at home, but like, you know, you
Yeah.
talk about the poops, like, you know, if you're
Right.
taking a video of a child, like if your child's breathing at home really fast and you're worried about the breathing or making a sound,
Mm-hmm.
parents will come in with like croup, right? So you talked about your child
Yeah.
having croup, right? And they make this sound at nighttime. It's like,
Right.
and then I don't know how that transfer over the speaker, but they'll make
It's good.
so don't quote me on that. But they but they will come in and the kid looks great during the day because it usually happens at night. And then we're like, well, the kid looks fine. I guess if it happens again, then come in and we'll do a steroid the next day. But sometimes it's like if you can take a video and like in the moment that you're seeing the child in distress or you know if you're seeing a child doing something weird, get a video, record it,
Yeah.
and so we can kind of see it because oftentimes you go in and the car isn't making that noise or the car isn't
Right,
doing that thing.
exactly.
Yeah,
Well, it's good to know that that's helpful.
yeah,
um, I didn't prep you for this, but while we're
yeah,
talking about when we should worry, since my other hat is mostly sleep challenges and
yeah.
potty training struggles, like what would you see with respect to sleep where you'd say to a parent, like this kiddo needs more sleep. You need to you need to do something about that. Like when should parents worry about
Yeah, I mean
sleep quality or quantity?
I mean, honestly, they should always wear. I mean, I think
Yes.
that it's obviously super important, right? I mean, we spend like a third of our day, at least half of our day for the younger ones, you know, sleeping. You know,
Yeah.
I feel like no, and everyone. The problem is, I feel like nowadays we, you know, our jobs are different. You know, our family structure is different. There's lots of families that are like two people working, and you know, the work sometimes like you know spills into the after hours. You know, it spills into the weekends. You know, so it's hard to kind of get on a schedule. Like it's
Yeah.
you know I feel like when kids are in daycare or in a more structured environment, they do a little bit better than at home. You'll see that often. The
Mhm.
daycare is not having issues, but at home, it's like really a mess, you know. And like sometimes it's because there's so much more structure in daycare, but which is hard to structure our lives at home, you know,
Right.
because we're trying to do lots of things, cooking dinner, like taking care of other family members, you know, taking care
Yeah.
of our kids. But I feel like sleep, it's important to be consistent, right? I mean, I'm sure you
Yeah.
tell your
Sure.
the people you work with about this, but you got to be consistent and sleep. Yeah, you'll see like sometimes kids will be acting out more at night. You know, they'll be overtired,
Hmm.
and they'll just that'll be a sign they need to go have more sleep. You know,
Yeah.
sometimes I think one of the things I've learned from you is that you know sometimes you got to bring the bedtime a little earlier. You know,
Right.
maybe if we're going a little bit too late, and maybe if you bring it earlier and
Yeah.
hit that magic sweet spot,
Yeah.
they'll do better with their sleep. They'll be able to get down to sleep. But it's everyone is different. Every kid is different. You know.
Yeah. And I've worked with parents who think they have like a really difficult, challenging child, and it turns out they're just a really underslept
Yeah.
child. So
Yeah.
it's definitely something to look at if you're having behavioral challenges. I know we're always looking for just any like noisy breathing, particularly when they're sleeping, snoring,
Yeah. Yeah. Of course.
all that kind of stuff would be something you'd want to know about,
Yeah.
right?
Something you don't know. Maybe like have like a sleep study. Go to ENT. You know, if the tonsils are
Hmm.
bigger. But usually we like to see them in office and kind of do an exam and see what their tonsils look like. Sometimes they have to get an X-ray for their adenoids, and
Yeah.
sometimes you'll see that they'll be mouth breathing like that all the time. But yeah, definitely,
Yeah.
there's medical reasons that you know they could be affecting their sleep, right?
Absolutely. And to go back to poop, because I just
Yeah,
can't, get enough talk about
yeah.
poop. Uh, I hear lots of mixed things about when to worry about poop frequency. Do you have your own opinion that you want to share?
Oh
And
my
I'm sure it
gosh,
depends on
yeah.
the age, but like parents will panic about them
Oh my
skipping one
gosh,
poop.
yes.
Or they'll
This is
say
great.
like they haven't gone in 5 days and I'm not worried. And in my head, I'm like, oh my goodness.
So,
So like, yeah, what
yeah,
should we
this
do
is
about
this is
that?
like oh, I tell you, we can really do a whole podcast about this. I mean, and if like my nurses knew that I was doing this, they would be like, oh my god, we have so many things to tell you. But
We will schedule another
yeah,
one just for poop.
but but I mean, you know, early on, you know, so we like to talk in like ranges, right? So just to give parents like, you know, I mean, there are some exceptions to this, but you know, early on in the child's life, the poops can be as frequent as like 10 times a day to
Right.
once a week. Okay, so
Okay.
parents will often call us and tell us the child is like a 2 week old baby or a 1 month old baby hasn't pooped in 24 hours, and I'm just like, all right, call us in a week, okay? And sometimes those people call us in a week, and I'm like, oh, give it 2 more days. Okay. Like,
Oh
let's
my
do.
goodness.
So it's like, honestly, like, as long as the baby is passing gas, right, you know
Okay.
that everything's working. They're not obstructed. As long
Okay.
as the baby is like feeding well and not like spitting up and, losing weight. I mean, you
Right.
can always bring in kids for weight checks, and like you
Right.
said, if some parents' gut is like, they were pooping like 8 times a day and now they haven't pooped in like 5 days. But sometimes that happens when like a mom transitions from breastfeeding to formula, or
Sure.
there's like lots of other questions we need to ask too, just to make sure, like maybe even just to reassure the parents, oh, you transition from breast milk to formula, that makes sense that the poops change. Or you transition from formula to whole milk, poops will change
Right.
like when you do that. But yeah, I mean, like some parents call us about 24-hour no, that's fine. We like
Okay.
three
Well,
days,
and I
like that's
imagine comfort is a factor. Like if your
yeah,
child's acting normally, they don't seem like they're just uncomfortable or in pain. That's sort of one picture. Whereas like
right,
some of my kids skip a day and they're already in pain.
already
So
in
like
pain,
maybe
yeah.
that's a different
Right, exactly. And also,
thing.
like, we ask about the texture of the last poop, right? So if the last
Mm-hmm.
poop was like super hard and they're going like once a week, then we got to do something about that, right? But if it's
Yeah.
like, if the poop is like was normal when it came out and they're
Yep.
passing gas and they're eating fine, that's less of a concern. So it's like kind of the whole
Yep.
picture you got to look at. It's not just the one item, that needs to stress
Right.
us out. But
Okay, so if you're worried, still call,
yeah,
particularly if you're seeing more than it's been 24 hours.
yes, I mean,
uh,
yeah, or
because
more
there
than
may be
7 days.
some follow-up questions that you need to know, or yeah, more than 7 days. What about, so like the 2 and 3 year olds that are potty
Yeah,
training? They often
yeah,
go from pooping multiple times a day
yeah,
because they can to just once
yeah.
a day. When is it the same at that age? Like if it hasn't been a
No,
week,
no,
you're not
it's
worried?
different. No, it's different at that age. So I feel like the week window. I mean, I don't know when the. I usually like if a kid is. That's a hard question. Like medically,
Hmm.
don't
Right.
But I feel like probably by like 6 months, the poops are a little more regular.
So it's more of a
But
newborn
yeah,
thing.
but actually, but by around 3 months, sometimes the poops do kind of start going every 3 days. I kind of say sometimes the
Okay.
poops will start going every 3 days around 3 months, and then as they get a little older, it starts to get more and more regular. As we're doing solid foods, it gets more and more regular. For a 2 to 3 year old, yeah, I mean, they often, sometimes as they're potty training, lots of these kids, lots of cultures will potty train at like 18 months, 2 years old,
Hmm.
So lots of these kids can control their poops. They just prefer to poop in the diaper. And
Right.
sometimes they just start withholding their poop.
Oh,
Sometimes it's like they
yes.
have one hard poop and then they start withholding it. And then it's more of a behavioral issue. And
Yes.
sometimes if you're withholding your poop, you will get a little constipated. So sometimes we need to do something about that, whether it's like, medicine like Miralax or prunes or fiber
Hmm.
or, fruit and water. I mean, lots of times when these kids are constipated, they don't want to eat as well, or they're more picky,
Right.
right? So it's like a
Yeah.
little nuanced, but something to talk about at the well visit or call us about, or look at healthychildren.org.
Right. Yes. I haven't checked their poop advice, but I'm
Yes.
certain that it's good. Okay, that's good to know. So let's shift a little bit. That was some pediatrician questions, and some of those we may do some deep dives into on another episode. But let's shift to just your dad hat now. Take your doctor hat off if you can, because obviously most of the resources that and parents I bring on here are women, and I like
Yeah.
to have something for the dads as well, or just to even help us get the male perspective. So when you had your first one, and you were already a pediatrician, did you just
Yeah.
feel like totally equipped, entirely confident when you became a dad yourself?
Well, did I feel yes, I definitely felt I got it in the bag. I was like, this is going to be easy. Actually, my colleagues still make fun of me sometimes because when I first had my child, when my wife was pregnant, we were just going out to dinner. We were overextending ourselves. We were like staying
Of
out late. I was
course.
working, we were going to birthday parties and weddings, and I was like, oh, this is going to be great. I'm a homebody, so it's like I was like,
Okay.
this is going to be a great excuse. We're going to have a baby, and we're going to put the baby to bed at 6:30, 7 o'clock, and then we're going to like make dinner and have time together, and just it'll be great. And my colleagues like, what are you talking about? That's not how it works. And I'm like, well, it's going to work. We're going to be very structured.
Like you'll see.
No, that did not. There's no way you can prepare, I think, for being a parent. Like honestly, it's like that's the one thing that like everyone should know is like
Mm-hmm.
it's really hard to. You can read all the books you want. You can know as much as you can work with families. I mean, it did change how I practice. I'll say
I
like
bet.
being a parent, which was amazing. So I feel like I have more street cred. But but I feel like there's no way to prepare. Like I read books and I've obviously been trained in pediatrics, but
Yeah.
it's like, even the beginning, like when, these moms are, it's like having a child is kind of one of the most barbaric things. Like
Yes.
it's so hard to control what goes on. And it's like,
Yeah.
I just, yeah,
Yep,
I,
definitely. I'm sure it made you more empathetic or sympathetic, whatever the
oh, for
appropriate
sure.
word
And
is.
I
Because
mean,
it's
yeah, go ahead.
easy to give advice, but now you have the perspective of like, yeah, saying it is one thing, but like implementing it,
Oh yeah.
remembering it is a whole nother ballgame.
Right. And also like for us, it's like, I know what I'm supposed to be doing, but sometimes that's not, I can't do that. Like, so like, I
Yeah.
don't know what it is. Maybe it's the way I was raised or the way my brain works, but I
Yeah.
can't, I need to like, my kid cries and it like pulls on my heartstring. I can't like let
Right.
them like cry it out. I don't know. It's like very tough for me to do these things. And
Yeah.
it's different for everybody. Some people are
Right.
like,
And yet you'd probably tell a parent, like, yeah, it's
yes,
okay. Go ahead, do it.
100%, 100%. Yeah. And I know it worked. Like, I know it works. I mean, in the
Yes.
end, I did it and it works. It's like, but it's like, took me a really
Yes.
long time to do it. Um,
Yeah.
and I
It's a
guess,
lot more emotional.
again, it's like just even the whole childbirth thing is just, to me, is like, it's just it's like crazy. Like, I mean, I feel like
It,
one of my kids came out, my first kid came out and was like, swallowed the meconium and like was blue and not breathing. And
it's
like, we're just
scary.
like, I'm like, suction him out. Someone suction him. And my wife is
Right.
like, is he okay? And I turn around and she's like getting sutured up. And like, I was
Ugh.
like, what? And I'm a pediatrician. Like I knew everything about like everything to expect, but it's like horrifying. But
Right.
then like, I never knew about what the women go through. That
Right.
is, that is a whole nother thing that they never taught me in pediatrics, that these
Yeah.
moms are like going through all this stuff with like all
Yeah.
post childbirth care and stuff of that area. It's like just, oh my
Yeah.
gosh.
It's a lot. That had to be incredibly helpful to see. I'm pretty sure I was a complete and total hot mess when I took my son for his first pediatrician
Yeah,
appointment.
yeah.
Um, I'm pretty sure I burst into tears right before we left, or while we were there, or probably both. I don't know.
That's
And so now you can understand why, like your
yeah.
whole life just got turned upside down, your body, all of it.
Oh man.
Um, Definitely eye opening. It's, yes, it can be barbaric, it can be beautiful. It's usually all those
Yeah,
things
yeah,
rolled into one. It's definitely an experience.
yes,
So you mentioned like your vision of what early parenthood
yeah.
would be like, not necessarily matching the reality that
Right.
arrived. Would you say that was the most challenging part of those early days, or would you list
Yeah.
something else as the most challenging?
I mean, I feel like everything was just like you have these fantasies, like you said, the vision, and like then the reality is so different. Like you see all these pictures
Mhm.
from friends on Facebook, you hear about all the great things about being dad, but it's like you're in it in the trenches. Like I've done 30-hour shifts where I took taken care of like 20 kids. I'm like, oh, this is easy. I'm just gonna have one kid, and this is gonna be easy. I'm just gonna change it. But like, no, it's like the thing is, you don't get to like sleep for 12 to 20 hours after that. So it's like you just do that every day for like 9 years. And
So
it's
you're
like,
not thinking
yeah,
clearly and you're emotional.
yeah, exactly. And I mean, like, obviously, I didn't go through childbirth. I don't have the, hormonal changes, but I mean, definitely it's emotional for dads too. Like, I mean, it's a
It's a
huge
huge
change in
transformation.
our
Yeah,
life. Yeah. And like,
absolutely.
you're just, the sleep exhaustion, I think for me was the sleep deprivation for me was the toughest part. And I'm used to sleep
Yeah.
deprivation, which is like,
Yeah, right?
I'm
This is
really
a
used to that.
different
Yeah.
form.
Yeah. And just,
uh,
yeah.
did you find yourself worrying? Like we've talked a lot about parents worrying about things when they have a brand new baby. Were you good on that part, or were you like, oh, despite all I know, I'm responsible for this little human, and I'm worried about everything too.
No, so there's a lot of things that first time parents worry about. And honestly, in my first visits, I usually like run through the list of like the 10 things that like they're worried about. Like, it's like whether it's like little rashes on the baby's body, like, lots of parents will freak out about these little, very common rashes on the baby's body.
Yeah,
They worry about like the vaginal discharge that girls might have, which is totally normal. They worry about,
yeah,
the clicking in their arms when they pick them up. Did they break their arms? Like, but all these things are like,
yeah,
what else? Like, I just like, there's so many things that lots of parents, first time parents, will worry about. And that for me was like, I'm like, that's good. I got that in the bag. I know not to worry about that. My wife was worried about it and she's like, is this normal? And I'm like, yeah, it's totally normal. She's like, call the pediatrician. I'm like, I'm telling you, this is normal. So it's like, yeah.
She
So
like
I don't
just
know.
completely forgot what you
You
do,
know,
right? She's like, I
yes,
want
exactly.
another
She's
opinion.
like, I think you're just making me feel better. No, I'm telling you, like, this is, but but
That's
I feel like that
hilarious.
was huge. Like you know, that was huge for me. I feel like a lot of the first visit in pediatrics is like kind of trying to reassure parents about all the normal
Hmm.
things to expect. And I feel like that's obviously the time when parents have the most questions. It's like usually like the first kid, it's like so many questions, and then like by the
Yeah.
fourth kid, the parents are like, "Yeah, we're fine. Just like see you in 2 years."
Right.
Like,
Yeah,
um,
exactly. When you took your child to the pediatrician, were you easy to deal with? Or could they like do pediatricians hate treating other pediatricians' kids and they just want to get you out of the office? How does that work?
I mean, I sometimes like I'll just go in and like pre-chart everything just to like help the flow. I know like how the flow is. I know it's like impossible. It's like I'm like, all right, okay, I already did everything. Like you just need to like see us and we're good. But
That's
I mean, for
awesome.
me, yeah, I don't think I was just wanted to know the kid was growing fine and making sure like I see the numbers, and I mean it's
Right.
just like comes natural to me. My wife, maybe it was a little harder. She was like, they're like, don't you have a pediatrician husband? She's like, I don't know. Like, I just want to ask
Don't
you.
trust him.
I was like, exactly. I'm like, it's so funny to see that part of her. But
That is really funny. And
yeah,
I don't know if that's unique. I guess I'll have to
yeah,
have some other married pediatricians and find out if that's a thing. I bet it's a thing. I think
yeah.
it's hard to see our person and then like the parent of our child
Right.
in the other role.
No, and I
Um,
get it. I get it.
yeah, she wanted to crowdsource for
Yeah,
varying
exactly. It's
opinions.
totally fine. It's totally fine. Um,
That's
but
great. So now that your kids are 7 and 9, what are you loving most about parenting right now that you're a veteran at this point?
I think I probably just seeing them. I mean, honestly, seeing them in their relationship with their friends. Like I think just
Mm.
like watching them like form friendships with other kids and like laughing and playing. Like we went through COVID. It was tough. Like we were pretty locked
Yes.
down, and and now like seeing them have friends and have like play dates and just have different relationships with different kids. And I love seeing them play with their friends, be like funny and just like enjoying the time with friends. That's for me, that's like the best thing. I think honestly, I mean, people always talk about how like you're only as happy as your happiest kid. Like it's like I feel like
Mm.
if I can find ways to get my kids happy, and on the other end, when my kids are sad, it's just that really affects me a lot. Like if my kids are sad or anxious about stuff, that really affects me as a dad.
Yep.
I mean, probably as a parent, I guess I should say, because I'm sure it affects the
Right.
moms the same way. But like, but when my kids are
Yeah.
happy, it's the best. So currently, like we're in a good place. But it ebbs and flows, right?
Yeah.
So
Yeah, for sure. So now that you're past the sleep deprivation stage and they're old enough to, enjoy and observe and all of that, what's challenging now for you as a parent?
well, let me be clear. I don't think I'm past the sleep deprivation
Oh,
phase.
okay.
I
Well,
mean,
we'll have to
like,
talk on the side.
yeah, exactly, yeah, exactly. Um, I've been meaning to call you for a while. No, but no, but I mean, kids get sick, right? So it's like,
Oh, yeah.
when they're sick, it's like we're up
All
cleaning up
bets are
vomit in
off.
the middle of the night. It's like, come on.
Hmm.
And like sometimes you're like, why did you vomit? I'm like, I don't know what's wrong with me, why I said that. I'm like, why did you vomit like all over your bed and turn 360 to get your carpet too? What is going like? And I'm like, I like am upset at my kid. I'm like, well, why should I be upset at my kid? What am I doing? I need to be like there present. It's just so hard
Let me
sometimes. It's
teach
like,
you to vomit
yeah,
efficiently.
yeah, just go to the bathroom. Like, oh my gosh. But it's like just but with all the
Oh,
I mean
my
there's been so
goodness.
much sickness, right? Like so
Yes,
there's been so much sickness this winter, and like, sleep deprivation, I think, you know, is
it can
always
definitely
there. It's always there. And like
can
when a kid is
definitely come
sick, you're
back.
just like you go backwards. Yeah, exactly.
Yep.
But
And
I'm
you have to
sorry.
still show up the next day
Yes,
for
exactly.
whatever, as a
Exactly.
doctor or as a parent or whatever you have to
Yeah.
do. We don't get the breaks, the time off we used to be able to take pre
Yeah.
children. Yeah. And it's hard. I mean, even you as a pediatrician, you can't always fix illness. You have to maybe just support it,
Yeah.
wait it out,
Exactly. Yeah.
keep an eye on things. And that's, I think that's really hard for all of us, whether they're struggling, emotionally or
Yeah.
illness wise. We just want to like take it away. Although cognitively, we all know that there's value in
Yeah.
like
Yeah.
learning to get through things and coming out on the other side.
Yeah, 100.
Uh,
You want to put a Band-Aid on it, on like all, I
yeah.
mean, especially for those emotional things. It's like, yeah, you just want to like say, just be happy, like feel better. But like, that doesn't work for adults either. So it's like, you need
Yeah.
to get them work through it, but it's so
Right.
hard. It's so hard.
Yeah. So you and your wife are both busy physicians. How
Yep.
do you yourself or each of you, like, do you feel like you have a work life balance? How do you make that happen? Like, I know I always feel like if I'm at work, I feel guilty I'm not with my kid. And if I'm with my
Yeah.
kid, I feel guilty that, my clients aren't hearing from me. I know that mom guilt is a thing. Is that a thing for dads? And obviously you can only answer for yourself.
Yeah. Right. I mean, I'm like, I think I think in particular, like, I don't know, I feel like as a pediatrician, I don't know what it is, but I don't feel like I'm like a very normal dad in this aspect. Like, I feel like, you know, my wife will often, well, maybe we won't talk about that, but, but unless there are any other dads
On
under the
second
bus, but
thought.
sorry, guys. But, I feel like, uh, you know, it's just, I mean, I have a little more flexibility in my schedule. I'm thankful
Right.
for that. I mean, and I really did feel that guilt, of like not being around. I mean, it's like I love being with my kids, right? But it was also like very tough, right? So like my days off when they were younger was like the hardest day. Like, so shout out to the stay-at-home moms. Like those days, it's
Right.
like you're just
And
like
and we
feeding.
have some stay-at-home dads too.
Yeah,
It's not as
exactly. Yeah,
common, but they're out
exactly.
there.
Yeah, exactly. Yeah, stay-at-home parent. It's just like, but those days, like my off days, like it was just like playing with the kid constantly, feeding the kid,
Yeah.
doing the laundry. It's just like, oh my, I'm like dead at the end of the
You
day.
aren't
Uh,
off. You're just
yeah,
not at your place of employment.
yeah, exactly. It's like sometimes like going to work was easier, like
Felt like a
but
break.
yeah, because it was more structured. Honestly, like I knew what to expect. I have a schedule, and I go home, and
Yeah.
but yeah, like you never know what comes up. You never know what the kids are going to be upset about, or what'll happen with the naps.
Yeah.
But I think going back to your question, so basically work life balance. I feel like there was a point. I mean, I will say during COVID, we were very lucky not to be sick, and I feel
Yeah.
like I said, I'm a homebody, and I feel like we were kind of like not overextending ourselves. We couldn't. There was no birthday parties. There was no soccer. There was no basketball. There was no this and that. And I feel like that was kind of like we had, our work. We weren't seeing like so many sick kids, so we weren't really that busy. People weren't calling
Mhm.
us about, ear infections,
Right.
and so I feel like we were able to spend a lot of time as a family together. I mean, we
Yeah. Some
had
people
a
benefited from COVID.
yeah, I mean, it was very interesting for our family. I mean, thankfully, but that was, I feel like when I had the most work life balance because my work
Right.
level was a lot lower and the
Yeah.
needs. So I had time to like answer messages and emails and
Mhm.
stuff. But sometimes I feel like, you have like all these things that are going on in your head as a physician, and, you just have like patients you're worried about, or patients you need to get back to. And it's just like always in the
Yeah.
back of my head. I have messages I need to get back to. And even when I'm at home, I'm like stressed about, I need to finish my charts, it's like
Yeah.
that part of it is, I mean, it's part of the job, but it's
It's
like,
hard to separate.
it's hard to
Nice
not,
to know that you are thinking of us and our kids when you're not
yeah,
at
of
work,
course.
though. I
I
mean,
mean,
I'm sorry that
yeah,
happens to
no,
you,
no,
but
I don't mean to, yeah, I mean, it's part of the job, but it's like, I mean, with any job, I mean, even if I was in, I mean, honestly, I don't really understand many jobs that are not medical related. So, but like,
right.
even if I was in like finance, or, I mean, some like, I don't know, if like lots of jobs these days spill over, like any kind of, even your job, like it spills over into like
Yeah,
after work, you're worried about people, you are emailing people,
absolutely.
and I just feel like sometimes it's hard to separate that time out, to spend time with your kids. And,
Yeah.
when I'm on call like once every 2 weeks, right? So my kids will be doing
Hmm.
something great at home. Just an example, like, they'll be just playing, and then I take the phone up to make a phone call, and all of a sudden the kids are like trying to kill themselves on those screens. Like, what? I was like, guys, I'm literally on call. Like, I'm talking to a patient. Like, what are you? Just calm down for a second. What happened? Like,
Keeping it real. We're
the
just,
second I
hey,
the second I go to the phone, it's just like,
yeah, that is definitely, an aspect of parenting that I think is universal.
yeah,
No matter what you do, you're just not allowed to be on the phone or
yeah,
otherwise occupied. But at least it makes you relatable to the parents
yeah,
calling in, right?
yeah. And
That's awesome.
honestly,
Did
they were able. Yeah, exactly. Please edit that one out. But no, but they were able to, like, I leave at like 1. like 2 days a week, and not really one because I still have everything to do. So I leave like 2:30, but I'm able to pick up the kids at school, and then I
Yeah,
take them to
that's
like the
awesome.
practices and whatever other things we're doing, and
Yeah.
and I'm off on Wednesdays now. So like I used to be working 5 days
Okay.
a week, so it's like kind of like I was able to like ask for things, and if you never ask, you never know if you're going to get it. But things
Right.
to like make my work life balance better for me and our family. So, and I mean, and my
That's
wife is
excellent.
flexible enough to like take off. Like I have patients scheduled like many months in advance on Sundays. So
Hmm.
on like Mondays and Fridays. So like if there's an event at school, she's able to like move her schedule around to be there for the kids, whereas I would have to cancel like a bunch of patients. So it's kind of nice. We got,
Right.
yeah, I think the
So that helps
communication
out
piece,
too.
yeah,
Okay.
making sure like we're both kind of contributing to everything is really
Yeah.
important.
Yeah. Do you think there are aspects of parenting or challenging areas of parenting that are maybe exclusive to dads that
I,
that we
yeah,
don't
well, I
experience?
mean, one, we can't breastfeed, right? So,
Absolutely.
uh, um,
Was that a bummer for you?
no, I mean, but it's like, often hear from dads, like, just friends and stuff, and also just myself, like, there's lots of times there's like a big bond with the moms, early on in life, and some dads do feel like they don't get that early on, and I mean sometimes that changes over time. It's like the babies really like their moms early on, especially if there's that closer bond, and like moms often have time off of work. You get to go back to work at like 1.5 weeks. It's like kind of like, I mean, that's
Right.
changing now, I think, for lots of jobs, but lots of the dads don't get maternal leave because they're not healing, or
Right.
paternal leave. But and I feel like that forms a bond for the moms, and then the dads come home and they're like, "Well, why is the baby like not wanting me? Why does the baby cry when they rub
Right.
against my beard?" Like, you know,
Yeah.
um,
And they're
so
too
that I feel
young
like
to like, you can't throw them up in the air or they can't catch a
right,
ball yet. So like, what
right,
do we do with
exactly,
them?
yeah.
Yeah.
But it still feels like the child might prefer the mom, which is fine. Like, and that goes back, and I think it ebbs and flows. But I think it's
Yeah.
good to know that
Well,
dads, sometimes if you stick through it,
yeah. And I think I mentioned this on an earlier episode, but I'll say it again in case someone didn't hear it. I have control issues, just being honest. Uh,
me
so
too.
when I had right, when I had my son, our son, see there it is. When
Yeah,
I had my son, when we had our son, sorry, I it would have been my inclination to be like, if he was upset, like I'll just take him. I can do it more quickly. I can do it
yeah,
better, or like whatever thought would have gone through my head. And,
yeah,
and yeah, sometimes that's true because maybe a mom's instincts, or maybe it is because they have the benefit of breastfeeding. Um, but I found we had a really, really, really fussy baby, and he was also very large, and I'm very tiny. And there were times where I just would be
oh,
like,
yeah,
I need you to figure something out.
right,
And when I kind of backed off just out of necessity, probably because I was incredibly exhausted, um, my husband at the time, he figured out this amazing, like we called it the daddy move.
yeah,
He came up with this, like the kid wouldn't stop screaming, and he had like his head in his our baby's head in his hand, and he did like this deep
yeah,
lungy bouncy thing that I never would have had like the strength or the stamina for. And it became like their thing, and I would always be like, oh, we're heading toward, reaching the point of no
daddy move,
return, we need the daddy move. And I was able to realize pretty early on that if you don't always insert yourself, like dads will
yeah,
find, I can't speak
yeah,
for all dads, but they will generally find a
yeah,
groove or a thing or a way to chip in. So moms, just be careful that you aren't of that mindset of I can do it better, faster, cleaner, whatever. Like
yeah,
let them find their way. Um, I think dads have the benefit of having sort of more property. They tend to run hotter. Their voices are deeper. Like, so for soothing, that can really be
yeah,
awesome. They
for
just
sure.
want to like nuzzle up into the little crook there. And, but yeah, we do have to kind of give you some time and space to, when it is not feeding time, if we're breastfeeding,
Yeah, exactly.
to figure that all out. Definitely. I didn't prep you for this either, but the other dad I had on, I was asking him, like, did you have a village when you first had your
Yeah.
babies, of like other dads that you could be like, here's something that I hate. Do you hate this too? Or like, is this normal? Or do dads not really have that? Or do they not need that?
I mean, well, I had a village in that we have our, so I guess you're talking about like, do I have other dads to talk to? Yeah. I mean,
Yeah.
I mean, obviously two of my colleagues are male, so I had them. So, and I feel like Yeah, I had plenty of friends. Most in pediatrics, like it ends up being that most of the pediatricians are women. So
Yeah.
most of my friends are actually female. So it's like it's kind of hard. As like most of my friends are female. So even in high
Right.
school, most of my I don't know. I just gravitate toward like, but I have like some very good friends who are male. Not all of them have babies. So
Right. So you're going to
uh,
end up being that person,
yeah,
maybe.
exactly. But it's like, yeah, I definitely, I think it's really important though, what you said, when you said, that sometimes just hearing that other people, it sounds awful to say this, but like hearing that other people are having an awful time is actually very helpful sometimes.
Yes.
Um, I feel
Yeah.
like this even happened in like residency. We would just be like, "Oh my gosh, that call was so bad," and like the other person would tell us about how bad their call was and how hard it was, and like,
Right.
I'm like, "Oh, I feel better just because you told me you were having a tough time." But in
Yeah, because if you don't talk about how hard it is
yeah,
and how you don't necessarily love every minute, and
yeah,
nor should you feel like you have to, then you
yeah,
feel like something's wrong with you or
yeah,
with your
the
kid or your
baby, yeah, exactly,
experience, right? Whereas if we could just be a little more real about it, it's like, no, that, yeah, how would that even be possible to love and savor, you know,
right,
every
and
minute of it? What do we do that with? Nothing.
right, exactly, right, and it's really tough because like social media, you're looking at parents are often like scrolling through social media when their kids are napping and like looking, and it's like really tough. You're seeing like the best moments of these people's lives, like,
It's
and even me,
curated.
like what, yeah, exactly. And when I would be off on like whatever Wednesday with my child, I wouldn't send the picture of my child like having a tantrum all over the floor. I'd send a picture of us like in the playground eating ice cream,
Of
like to my wife, like,
course.
"Oh, the day is going awesome," but like it's like
Right.
half the day I was like losing all my hair, like,
Right?
it's just
We'll
like,
blame that
so,
on the two
yeah,
kids.
exactly. But it's like, you know, it's really tough. Like you think about all the, like, you, like I said, it's like you have a fantasies about being a parent and like
Yeah.
you see all these things in movies and, all these things and you just think it's going to be one way, but it's just like, it's just throwing curveballs at you all the time, and you're just
Yeah.
not ready. And I
And
think,
no matter how much, like sometimes I think people don't hear that in
yeah,
advance. In other cases, they hear it. It's just that you
yeah,
don't really get it
yeah,
until you're in it,
right.
which is what you were saying at the outset. Like, you can't really ever prepare someone for what their experience is going to be like. Um, All right. Well, that's a good perspective. So I appreciate all your insights. We'll wrap up soon. I have one more question for you. So the premise of this show, obviously, is to bring gems of information to parents almost before they even need to know it. There are certainly things I've learned the hard way on this journey, and where it was like that would have been helpful to know, whatever, a week ago, a month ago, a year ago.
Yeah.
So is there something, one thing, or maybe more than one thing, that you've learned on your own parenting journey that you wish you had discovered or realized sooner, and you would want to tell other parents today?
Yeah, there's so many things, but I feel like, my two kids, we have a 9-year-old boy, 7-year-old girl. They're wildly different in personality,
Mm,
and I feel like it's interesting to me because they have the same parents, the same household. But they are so different,
same
worlds apart.
nurturing.
Yeah, same nurturing, and I feel like it makes you have to change your parenting style, right? So I mean, like you have one parenting style, and then all of a sudden this other kid comes along and they like have different needs,
Doesn't
right?
work for them.
Right,
Yeah,
and it's like that's the hard part to know. Like, I mean, I'm trained in pediatrics, and I'm pretty controlling, right? A little bit. I feel like I know what to do, right? I know what the books are supposed to say, but like it's different for every kid, right? So I
yeah.
feel
I
like
always say the kids haven't read the books; they don't care.
exactly, yeah. I mean, even like diseases are different. Like even like actual
Sure.
sicknesses look different in many different
Yep.
kids. So it's like really hard to diagnose some things sometimes. But
Hmm.
like the medical stuff aside,
Yeah.
just I think just like trying to meet the kids at their level and trying to like change your parenting technique, which is really hard to do in real time, right? It's
Oh
like
yeah.
so hard, and that's why you need like parent coaches and like friends and like pediatricians and
Absolutely.
healthychildren.org.
Yes.
But like trying to change your parenting skill is tough, and I feel like it is important to like just help them be the best version of themselves, right? Like,
I love that. And
yeah,
one thing I've found personally hard that I don't think I've talked about on here yet, um, is that my son and I often needed to go about different various things differently.
Yeah.
Like
Yeah.
when I was helping him try to learn to sleep independently because I could no longer function and I had postpartum depression and all that.
Hmm.
I wanted to be very warm, fuzzy, and hands on.
Yeah.
I didn't want him to cry, and I especially did not want him to cry alone. I took attachment crunchy parenting to like the nth
Yeah.
degree because that's
Yeah.
me. That's what I do.
Yeah.
I'm in therapy. So it turned out that there was actually, I was torturing him for,
Yeah.
months with really little to no results except maybe confusion and frustration. And honestly, there was so much crying, which ironically was what I was trying to avoid. Only now I was spreading it over this long, gradual baby step process because that's what I wanted. That's how I wanted to present it to him. And so one of the things I help parents with a lot now is like, okay, how would you like to go about this? But let's also think about your kid. Like, is this going to be counterproductive, frustrating, overstimulating? Because he really needed me to just get out of his way and make it really clear. Sleep is sleep. When you go in, you don't come out. Go to sleep. And he got it like that. But I never would have jumped to that. I think there was value in me seeing that, all these other options were off the table. But that's a theme that I've encountered with him many, many times of like, I wish like he would fall down and I would want to have my
Yeah.
mom moment,
Right.
right? Scoop him up, snuggle him, kiss him. Oh, honey. He, ever since he was little, storms away, slams
Right.
the door, gathers himself together and comes back like nothing happened. He doesn't want any fanfare. And I was like, man, I'm kind of getting robbed here.
Yeah.
But, ultimately it's like, what does he need, right? It's not
Right.
really
Yeah.
about me. So
No.
that mismatch, I think for me was one of the biggest challenges of like, I wish you'd let me go about this with you in this way, but you're both part of it.
Yeah.
And I think if we can just make peace, like you were saying, that our kids do have their own individual, temperaments and eventually personalities, they may be different from each other. We may, crash into each other at times.
Yeah.
That's definitely helpful to learn and make peace with as early on as you can.
It's so hard because we're so ingrained in the way we see the world and the way we react to things that it's like, it's very, I mean, I don't know how you did that. Like, I don't know how you're able to like
It was
change
not
the
easy.
way. Yeah. Right. And it's like,
I think it was out of like, I literally couldn't stand
necessity.
anymore.
Yeah.
Yeah,
Yeah.
exactly. I don't know if it was a deliberate choice or if it was more of like waving the white flag of
Yeah.
like, I'm going to lay down and close my eyes and you're probably going to figure this out.
Yeah.
And then when he did, I was like, oh, that was when I had my moment of like, oh, he figured it out when I made myself unavailable because I just literally couldn't function. So I kind of discovered it accidentally, but maybe someone else can hear it more, more intentionally now. And as people with control issues, particularly if you factor in medicine, like I feel like you had a double whammy of someone who likes to control things. And probably if you can't, that makes you anxious. And
Yeah.
then with medicine, it's sort of like you can follow a like, check this out. And if it's not that, then go here. But with little humans that don't read the
Yeah.
book,
Yep.
there's none of that, right?
Right.
Like it just
Right.
doesn't go that way. And that can make parenting really hard for those of us that are used to like, I tell parents, like you can set the stage for potty training. You can talk it up in advance. You can get all the cool things. You can like, I'm going to help you with this. It's going to be so exciting. You cannot make a child poop and release
exactly.
their pee or poop. That has to be something that they release on their own.
Yeah.
And for those of us with control issues, that can be really frustrating. Like, just do it. But we gotta step back. They're in charge of that, and it's hard to let that happen.
Right. And I think one of the biggest stresses with that is that lots of the schools require kids to be potty trained by a certain age, which I feel like is a little bit unfair. Like because some kids, and I feel like that's a huge stressor for parents because they already spent all this time being on wait lists for schools and they're just like losing their mind sometimes. And I'm like, ugh, like it's really not good to like make them poop and force them to do it.
I would love to do a whole another episode of like developmentally inappropriate things that kids are required to do by arbitrary ages, just because.
You just want to do a whole episode on pooping, don't you?
Yes.
I feel like everything comes back to poop.
Everything comes back to poop. I might have to name this episode "Everything Comes Back to Poop." I never thought, as a 45-year-old woman, that I would spend my days with so much focus on poop. It's what I've been reduced to. Awesome. Well, that was really helpful. Yeah, go ahead.
I was going to say the thing you just remind me of, just going back, is also, and my male friends, I remember we had a lot of trouble sleep training our second child. yeah, it was our second child, I think. And we
See how
still are
tired you
having
were? You
we're
don't
still
even
having
know.
trouble. Yeah, exactly. I don't know, it doesn't matter. But anyway, we were having trouble sleep during one of them, and we're it was like we couldn't do cry. We were so bad at the
Yeah.
cry it out method, and we it was like the kid was like 9 months old, 8 months old, or something like that. My friend who was a pediatrician, my wife was away at a conference, and my friend's like, "All right, I'm gonna bring a 6-pack of beer over, and we're gonna sit there with the monitor, and I'm not gonna let you go into the." And I was like,
Oh
so
my
we like,
gosh.
we did the whole Ferber method, the 5, 10,
Right?
15 minutes, and it worked amazing, and it was like
Oh
a
man.
pediatrician male
Shout
friend was like,
out to
"We're just gonna
that
do it."
dad
I know
friend.
exactly, yeah. So
That is pretty
that was the
awesome.
best. But yeah, I mean,
Yeah.
it takes a village. Like, we also are like, we live like 15 minutes from both of our parents, so like,
Right. So you
we have
have
that
to
as a
kind of
resource
create
too.
your
Like,
own.
yeah, and I feel
Yeah.
like we're lucky to have that. And, sometimes that can be tough, but sometimes that can be great, and most of
Right.
the times it's great for us. So we're lucky, but it really does.
Well,
I
and I
think like,
think I mean, you can correct me if I'm wrong, but I think what your friend provided for you, maybe in that moment, was like the reassurance of hindsight, is what I call it. He was like,
yeah,
look, I've been through this, or I've seen
yeah,
people go through it. I know that it works, and I know that there's an end point,
right,
and then there's the benefit that comes after that makes it feel worth it, right? But you had none of that.
right.
So when a family comes into your office and they're like, look at this rash on my newborn, I've never seen anything like this,
Yeah, right.
you have the ability to be like, oh, that's whatever, and we see it all the time. And so you kind of got to experience the other side of that.
Yeah. And it's
Yeah,
really hard. Parents often come in and they're like, there's the diaper rash, right? And then like, I look in the diaper and I'm like, where's the rash? Like, literally, this looks totally fine. Like, and they're like, don't you see that little spot? I'm like, oh my gosh. Sometimes the skin
oh my
literally
goodness.
sloughs off the both sides. And I don't know.
Right?
Sometimes it's really tough for me to like, I feel like, parents are like, but I'm really worried about this. And I'm
You
just
don't want to
like,
be dismissive.
it's really tough. It's really tough sometimes because parents are sometimes super worried and you're just like
Right.
trying to not be dismissive, but, also being like, I've seen way worse, like 20 times worse than this.
Right.
Like, I wouldn't even
Right.
consider this a rat.
I'm
But
sure you have to sometimes take a breath and like choose your words and
yeah, I know.
reactions very
Yes,
carefully.
exactly.
All right. Well, this was excellent. It sounds like we will need to schedule deep dives in the future. But Dr. Madani, thank you so much for joining me and sharing
Pleasure.
your pediatrician viewpoint, your dad viewpoint. Listeners, viewers, I will be back soon with more stuff that I and other experts and parents wish that we knew sooner. In the meantime, I'll leave you with my list of things that I've learned the hardest way. I'll change it up soon, but for today, it is still accept help when it's offered. Ask for it when it isn't. That's that find your village. If you don't have friends and family, use them if you have them. And then number 3, you are the expert on your child, so trust your gut. And 4, if you need to be the squeaky wheel, even if it means bringing in a picture of poop. Thanks, everybody. We'll be back soon. Bye bye.